So, ironically, I'm an interventional cardiologist, but one of my passions is preventative cardiology and keeping them out of the cath lab, making it so that we modify those risk factors and keep them tip-top shape so that we don't have to meet you, under the spotlight, so to speak. I certainly think there's a role for the cath lab, but I think there's an art to keeping somebody out of the cath lab as well. And that starts with your primary care physician or your family doctor, and it's continued with your cardiology appointments. So that's what I really do have a passion for, and I think patients need to take ownership of that too at home. First, take a look at your family. If you have family members, specifically first-degree family members, mother or father who had early coronary artery disease, meaning blockages that were found before the age of 55, this is probably the strongest risk factor, and if you have this in your family, you should be seen by a cardiologist for a thorough history and physical. And the conversation should be had as to whether a baseline stress test on the treadmill should be done for you, because this is the strongest risk factor. Maybe you've been a non-smoker your whole life and you really don't have a lot to talk about with a doctor. It's hard to make that initial phone call. It's hard to say, hey, can you just check me out? But there's a big importance to checking your labs in a fasting state, at least initially when you meet a practitioner. And what that means is getting your cholesterol checked, checking your hemoglobin A1C, which is a 3-month average of your blood sugar, getting a once through of your electrolytes and your kidney function, and that can kind of get you in the game. Getting fasting labs, getting a baseline EKG, which is an electrical picture of your heart, and kind of cluing you in as to if there's something that needs to be trended, or if you're in a normal range, or if you're borderline and you need to change your lifestyle and revisit the labs in 6 months. And just talking with the doctor about your lifestyle habits, starting at an early age in your 30s, I think this is so important.